Did you know that nearly 25% of people living with HIV use cannabis to manage symptoms like pain, nausea, and anxiety? But what if it's affecting their medication without them knowing? In this video, we're diving into whether cannabis use could interfere with HIV treatment, and what science actually says about it. Cannabis has been growing in popularity, not just recreationally, but also medically. Many people living with HIV turn to cannabis for relief from chronic pain, stress, and to stimulate appetite. But here's the big question: could it be interfering with HIV medication? HIV treatment relies on strict adherence to antiretroviral therapy, or ART, to keep the virus under control. Any interaction with other substances could impact its effectiveness. In this video, we'll break down the research to understand if cannabis is a helpful supplement or a potential risk. HIV treatment depends on antiretroviral drugs that regulate viral load, but certain substances, including cannabis, may interfere with how these medications work. Here are some common concerns about cannabis use and HIV medications. Metabolism changes. The body processes HIV medication through the liver. Cannabis can impact liver enzymes, which could alter how these medications are absorbed. Side effects overlap. Both cannabis and ART drugs can cause dizziness, nausea, or cognitive impairment, which may make these side effects more intense. Medication adherence. If cannabis makes someone feel too high or sleepy, they may be more likely to miss doses, which is critical for HIV management. To fully understand the risks, let's take a look at the scientific research on this topic. So, what does science say? Let's examine the research. Potential benefits of cannabis for people living with HIV. Pain relief. Many people use cannabis to help with nerve pain and inflammation. Appetite stimulation. Cannabis is known to reduce nausea and increase food intake, which can be important for maintaining strength. Mental health support. It may help with anxiety and depression, which are common among people living with HIV. Potential risks and drug interactions. Liver metabolism issues. Some HIV medications, like protease inhibitors, are broken down in the liver. Cannabis may slow this process, leading to changes in how the drug works. Possible reduction in medication levels. Some studies suggest that frequent cannabis use could lower the concentration of certain HIV drugs in the bloodstream, which might make treatment less effective. Increased side effects. Some people report feeling more fatigued, dizzy, or cognitively impaired when combining ART with cannabis. One study published in the Journal of Acquired Immune Deficiency Syndromes found that while cannabis does not directly reduce the effectiveness of HIV medication, it may impact adherence. In other words, those who use cannabis heavily might be more likely to miss doses. So, does cannabis really affect HIV medication? The answer is that it depends. Research suggests that moderate cannabis use does not significantly interfere with ART for most people. However, heavy or frequent use could impact drug metabolism, increase side effects, and lead to missed doses. The biggest risk is not knowing how cannabis interacts with your specific medication. Since everyone's body responds differently, it's important to be informed and cautious. In summary, cannabis has potential benefits for people living with HIV, but it also carries risks. While it may help with symptoms like pain, anxiety, and appetite loss, it is essential to be aware of possible interactions with HIV medications. The most important takeaway is to consult with a healthcare provider before making any changes to your treatment plan. Have you or someone you know used cannabis while on HIV medication? Share your experience in the comments. If you found this video helpful, be sure to like and subscribe for more content on health and wellness. Check out our other videos for more insights on medication safety and well-being.